I'm BR VetMed, and today I'm going to tell you all about the terrifying condition known as meningoencephalomyelitis. It's almost unheard of, mainly because it's so hard to pronounce, but actually it's more common than you think, and it can affect almost all breeds, ages, and genders of dogs. Some of the signs of meningoencephalomyelitis, bear in mind animals don't have symptoms, they have clinical signs and subclinical signs. The clinical signs are dizziness, seizures, lethargy, balance issues, weakness, blindness, confusion, disorientation. And also on top of that, they can sometimes experience weakness of their jaw and trouble swallowing. So what's the etiology? That means, where does this come from? What's the causation of this condition? Well, meningoencephalomyelitis is actually usually a result of an autoimmune response that's attacking the brain and the spinal cord. Sometimes it's as a direct result of infection, as some forms of meningitis are. But in the autoimmune situation, a bacteria, virus, protozoa is fought off by the dog's immune system, but the pathogen is shaped like a commonly occurring protein in the body, and it turns the autoimmune system now against the body as well. When the dog arrives at the practice, there are a few different things that the vet needs to assess to know if your dog has meningoencephalomyelitis or encephalomyelitis. These clinical signs don't immediately inform the vet that the dog has meningoencephalomyelitis, but it is quite clear that a neurological issue is present and they'll need to investigate further. So, to actually find out what's going on, the vet will most likely perform magnetic resonance imaging, MRI, and on top of that, they'll likely perform a spinal tap. That's where they take the cerebrospinal fluid straight from the spine in order to test what's in it. They may also trial antimicrobial drugs in case it's due to an infection directly. In the MRI, inflammation will be very visible, it will show up very white. In the spinal tap, the cerebrospinal fluid will actually have a large number of eosinophils. These are a kind of white blood cells. And in most cases, especially if it's autoimmune or idiopathic, that means we don't really know where it comes from, usually eosinophils are also present in the blood tests as well as the cerebrospinal fluid. Now, as you can see for yourself here, we have an MRI image of a healthy canine brain. It's always important to see healthy first. Now look at this area of the brain and this area by the foramen magnum down towards the spine, and look at how even the colours are. There's not a lot of white, is there, either? And there's a lot of evenness by the foramen magnum. It's not sort of very bright and then darker and then bright and darker. So we're going to call this our normal brain MRI. So you've got that to remember. Now let's go on to the brain with meningoencephalomyelitis. Can you see this area, how much white there is? And white shows the presence of protons, H+ ions, and that's present in water. So we've got lots of inflammation, and you can see the unevenness around the foramen magnum there. So, is this treatable? With treatment, likely the prognosis could be 5 years, anywhere from 6 months to 5 years in actual fact. If it is due to an infection, then antibiotics and antifungals are going to be very important in this scenario. If it's of an autoimmune causation or etiology, then we're going to look a bit differently. We're going to need to have steroids, and we're also going to need immunosuppressants. Now, on top of that, it's often understood that an anti-epileptic drug will be needed to prevent more seizures if the dog's having them. If they're not having them yet, then it's not quite necessary, but usually they are. To finish, I want you to understand the word meningoencephalomyelitis. It's very long, and a lot of these medical terms are very long. It's very important to understand them. Meningo actually refers to effectively layers. There are slightly different words that you can use, but layers. If you put meningoencephalo together, then we know we're talking about the meninge layer of the brain. There's actually different layers of the brain, there's arachnoid, etc. So it's talking about the meninges, the layers around the brain. And then myel, often in Greek, refers to situations relating to the spinal cord and the cerebrospinal fluid, and itis refers to inflammation. And that's all for today. Thank you for watching.